The United States reaction to the coronavirus pandemic ranges from complacency to outright panic, while the White House tries to reassure a nation still split along partisan lines. What the United States government has done, and what has it done right? What needs more attention? The answer to that, I'm joined by Dr. Bob Arnot. He's an award-winning journalist, former chief medical correspondent for NBC and CBS News, best-selling author of more than a dozen books. He joins us from Stowe, Vermont. Okay, what do you think, Dr. Bob, how do you think the government to this point has handled this?
Well, it's a tough question because it gets so political. I do think that the last 5 briefings from the White House have been terrific. I think they've been pretty transparent. When they talked about why didn't you close down the United Kingdom, the next day they did. Dr. Fauci, I've worked with since he first got his job in 1983. He's the finest infectious disease specialist worldwide. I trust him with my life. And of course, we're all trusting him with our lives now. The CDC is simply the best disease surveillance organization anywhere in the world. So look, I think they've been very responsive. Today, the president interestingly said on the news conference that, if the Chinese had given us more notice, if they hadn't hidden all of this earlier, that we might do better. So listen, there's always going to be some second guessing in terms of did they act quickly enough? Certainly the testing, I think even the government admits, could have been on stream a lot earlier. There's a new paper out of China, and they showed that they sort of won. You saw the curve go up, up, up. It's going down, down, down. They think by May they'll have 0 cases of corona. But they did this by testing every single case, isolating every single case in their family. They'd actually bring in the huge, great big centers and put them in beds. Draconian, more than the US could do, but they eventually won. So listen, I would certainly give the medical team very high marks for being responsive. Now, where are we? We're miserably far behind in terms of intensive care unit capacity. We knew that up to 30% of the patients in China needed to be in some kind of intensive care. And as of this morning, in the states near to us, the ICUs are completely filled with routine patients. So there's almost no place to put these new coronavirus patients. The ICU ventilator problems are probably the biggest. There are 165,000 ventilators here in the US, but you could end up with hundreds of thousands of people on ventilators for weeks. The big thing to say, Larry, is this is all data driven, and we don't have very much data in the United States because we simply have not tested enough people early enough to know where we are.
But it's still a small percentage of people who test positive die. What kills you, doctor? In other words, if you have this and you don't make it, what takes your life?
So it's a very good question. This is a respiratory virus. For instance, I have pretty severe asthma, and I'm over that key age they talk about as high risk, so I'd be considered a high risk patient. Now, what happens is that the lungs simply become overwhelmed. That is the little air sacs where the air exchanges oxygen into the blood. They get surrounded by blood and inflammation, and they have to be on a respirator for days to weeks to be able to survive. So to answer your question, these are people already vulnerable. They have diabetes, they have heart disease, they have high blood pressure, they have asthma, they're older, and they get this acute respiratory distress syndrome. That's what they call it. Now, it can kill and has killed younger people. There was a report out this morning in pediatrics about the severity of this disease in newborns and in young children. So, it does hit across the spectrum. The most interesting thing, though, is that younger people, the millennials, may get few, if any, symptoms. And they now believe, and they're searching for the data to back this up, that there may be tens of thousands of infected people running around with no symptoms, but perhaps infecting others. And in Italy, one of the reasons they believe it's been so severe is that it's a multi-generational nation. That is, you have families living together, you have the children and grandchildren coming to visit their grandparents on a regular basis, and they believe that the grandparents and the grandchildren and the parents may have brought the virus to their grandparents, which is why you have an exceedingly high death rate there. So again, to answer your question, it's a respiratory virus. That's how people die, and it's a terrifying death. There are these phone calls or video calls in Italy where someone literally says goodbye to their family and they're gone a few moments later. It's not like these kinder, gentler deaths where you gradually sort of fade and you may go into coma. You're wide awake, but you're drowning because your lungs simply don't work. The statistics, about 8% of those 70 and older die, 15% of those 80 and older die. One very important point is, they talked about biological versus chronological age. Deborah Birx did in a press conference the other day. And I'd like to point out that people like yourself and hopefully myself who keep ourselves in great shape may have a younger biological age, and that hopefully will be helpful for us.
Those, doctor, who are acknowledged to have it but don't die, why don't they die?
So, Larry, it's a very good question as to why younger people don't die. And they think it's because they have a very robust immune system. That is, why do older people die of cancer? Their immune system isn't working as well. So that's part of it. And also, it seems that older people may have, a thing that we call a cytokine storm. All the facets of our immune system come to bear against this virus and create a storm that ends up killing us. But certainly the, teenagers, 20s, 30s, 40s have a much, much lower death rate simply because their bodies are able to deal with the virus. And they think that there are very few cases among kids, fortunately, because their immune systems haven't been exposed to lots of different viruses and may not have much of this sort of untoward immunological response.
President Trump called this initially a hoax. His temperament has changed since then. Are we late in this?
Well, there's no question we're late. We're certainly late because the Chinese didn't reveal this early enough. The doctor who first sounded the alarm was called in the police station and told to sort of keep quiet. Once the data did come out, we thought it was just going to be China. I think the president did well to cut off the air links between China and the United States. Italy didn't. Italy was late on that. And there are lots of Chinese that then made their way into Italy by train or connecting flights. So we've been very lucky that way. In these crises, you're always going to be pointing a finger that we could have done things earlier. And certainly the thing we could have and should have done a lot earlier, if we had the proper test, is to test. The Chinese experience, and it just came out yesterday, there's a Harvard study done with the Chinese, showed that because they were testing and they knew every single positive, and they could isolate them and they could quarantine them, they won. We don't have any idea. Right now, if you listen very carefully to the pressers, they're saying that healthcare providers and the elderly are going to get tested, and there really hasn't been enough testing yet. Now, the Admiral from the Public Health Service has talked about having this on stream later into the week, but this testing only shows if you have the disease. I spoke to a company today that has a serum test, which they hope to have approved by the FDA, that would show sort of the general background. But at this point, we just don't know. The governor of Ohio talked about having 100,000 cases. Do they have 100, 1,000, 100,000? We don't know. So, the World Health Organization would say that we're walking blind into this epidemic because the testing is way too late. You can blame the government for, not being prepared, but they've never seen anything like this before. So I think the thing I'm impressed with, Larry, is I watch these White House press conferences every day. And I do think when you listen to, Deborah Birx, when you listen to Tony Fauci, when you listen to the Admiral there, that they're highly responsive. They're looking at the data. They are data driven. For instance, the Imperial College data that came out just a day or two ago completely changed the game. Once they saw that there could be, hundreds and hundreds of thousands of cases and deaths that could go up to, 2 million or so, then people became alarmed and they really started to make these moves. Tony Fauci really said it best. If you're here, you're really there. So if you're reacting to this, you ought to be out there. And it's very hard in a democracy to be too far out in advance of this. Imagine if 2 or 3 weeks ago, we were all quarantined and had to sit inside. There would have been a revolt. But when you start to see the cases, see the picture from Italy, you catch up. So there's always that lag. And I think that we definitely are lagging. We're lagging in testing. We're lagging in terms of vaccines, which will take a while, although the first one was tested yesterday, certainly lacking in terms of treatments. But the biggest problem is this. Our healthcare system is overwhelmed. Yeah, I'm in Vermont right now, and I know that the two biggest hospitals close to me, their ICUs are full. I know that because I tried to refer for a patient. Took 2 days to get that patient in for a very serious condition. Down in Boston, the major hospitals there are often full. You're sitting in the emergency room for a day or two to get into an ICU bed in a place like Mass General. Governor Cuomo yesterday said in New York that 80% of the 3,200 ICU beds are full in New York already before they're starting to see the very severe cases. So the concern, Larry, is that we are quickly going to be overwhelmed. The hospitals are going to be completely slammed. And if you look in Italy, they rationed. If you walked in over 60 years of age, you did not get a ventilator. In England, they're already talking about rationing healthcare. If you're older, you're not going to get a ventilator. And that's why these massive efforts to try and blunt the curve from something that's sharp like this to a spike to something that's like this in terms of the caseload and the fatalities. But it is too little too late in terms of ICU beds and in terms of ventilators for the cases we're probably going to see. They talk about our being 7 days away from where Italy is right now, unless these efforts work.
Yeah, I know you visited the Middle East a lot. How do you explain why this is a runaway disease in Iran?
I think when you look at countries like Iran that is run by, a bunch of, and having seen what they've done to U.S. troops and seen what they've done in the Middle East by a bunch of terrorists, there isn't any transparency. There is a lot of cover up. And Iran is way, way, way too late on everything. They're talking about potentially millions of deaths there. Plus, they have a healthcare system that's not enough to snuff. So, they talk about Iran as a country of hostages. And I think that's true. I think the poor people of Iran have been held hostage by this nightmare regime for generations. And they're going to pay a terrible price because they're simply not prepared. They haven't been doing enough testing. They certainly don't have the healthcare facilities, and they're going to get slammed in a way that will be unmerciful to the poor hostage people of this country.
Bob, stay right there. We'll be back with more right after the break. Welcome back to PoliticKING, and back now to my conversation with Dr. Bob Arnot, the award-winning journalist, former chief medical correspondent for NBC and CBS. Are you saying, doctor, that no matter what your age, your best thing to do is stay home?
Well, Larry, yes. I think there was a little bit of fraud in the beginning of this where people talked about washing their hands all the time. If you were riding in New York City, you could wash your hands all day long. You were still going to get it if somebody next to you coughed. The real thing is distance. No one has proven yet that people are getting it from touching a surface. There is a new paper out this morning, and they say that, steel and then plastic, can live there for longer periods of time. I think up to 72 hours on steel. So it is a potential risk, and it certainly makes sense to wash your hands. But the advice this morning from Deborah Birx, the White House coordinator, is don't touch any surface when you leave home. Just don't touch any surface. And I think that isolating is the very best thing to do. Hopefully you haven't been exposed yet. These kinds of diseases, they do what we call burning out. We looked at Ebola, for instance, in Africa, and it would burn itself out because it was such a highly fatal disease, up to 75% in some countries. Here, if everybody stayed inside for 3 weeks, the virus would basically burn itself out. There wouldn't be any virus left around, even on countertops. So I think that the isolating is the most important thing. Surgeon General made a little bit of an error when he was talking about the elbow handshake. Doesn't work because you want to be 6 feet or more. So what I suggest is, like the Surgeon General, the Director General of the World Health Organization, put your hand on your chest. If you're religious, you could do something like this. If you're a surfer, you could do this. If you're a Trekkie, you could do this. but stay at least 6 feet away. And there was a case reported of people in a bus who apparently contracted the virus, who might have been 12 to 15 feet away. So what I would say is that from the very beginning, the watchword should have been distance, distance, distance instead of the hand washing. Nothing wrong with hand washing, but again, no proven transmission where we know that people do get it from a cough. Now, this morning's paper talked about the aerosols staying in the air for a while afterwards, hopefully not enough to infect a lot of people because it would have been a much, much higher rate. But we talk about what's called an R value, that is how infectious this is. You have diseases that might be a 10 or 12. In other words, every one patient would infect 12 people. Terribly infectious. But with this disease, it's about 2.4. So every individual could infect 2.4 others. What happened in China, though, is it went up to about 3 or so, and it's dropped below 2, down towards 1. Once you've dropped it down towards 1, and then every individual who has it is infecting less than 2 people, then you'll start to see it burn out. But Larry, to just answer your very good question directly, it is distance, 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 distance that's going to save us from this current epidemic.
Dr. Bob Arnot, thank you so much. You're an invaluable addition.
Well, you're a wonderful interview. I remember all those tremendous interviews you do over the years, and it's wonderful to see you looking so well and healthy and still helping the American public as you have for generations. Bless you.